BharatNet Project. Why in news? Recently, the Union Cabinet has approved 1.39 lakh rupees crore for the modernization of the BharatNet project. What is BharatNet Project about? National Optical Fibre Network, (NOFN), was launched in October 2011 and was renamed as BharatNet Project in 2015. It is the world's largest rural broadband connectivity program using optical fiber, and also a flagship mission implemented by Bharat Broadband Network Limited, (BBNL). BBNL is a special purpose vehicle, SPV, set up by the Government of India under the Companies Act, 1956. It is being implemented by the Department of Telecommunication under the Ministry of Communications. This project involves altering the execution strategy and employing village-level entrepreneurs, Udyamis, to provide fiber connections to the last mile, thereby accelerating the connectivity process over the next 2.5 years. It is financed by the Universal Service Obligation Fund, USOF. USOF ensures that there is universal non-discriminatory access to quality ICT, information and communications technology, services at economically efficient prices to people in rural and remote areas. It was created under the Ministry of Communications in 2002. Objective: the project aims to compete with private operators like Jio and Airtel by leveraging its presence in rural areas where these private operators are less prominent. The quality of service provided by BharatNet is expected to play a role in attracting users. It aims to connect all 640,000 villages across India with high-speed internet access. It seeks to bring broadband internet connectivity to each of the more than 2.5 lakh gram panchayats across the country. The government intends to provide a minimum of 100 megabits per second bandwidth at each gram panchayat through BharatNet so that everyone, especially those in rural India, can access online services. Revamped approach. Similar to private telecom companies like Airtel and Jio, the revamped BharatNet model will collaborate with village-level entrepreneurs, VLEs, for the implementation of fiber connections. Under this approach, the government will bear the cost of extending the infrastructure to homes, while the entrepreneurs will contribute to the maintenance and operation of home connections. This partnership will work on a 50-50 revenue-sharing basis. Phases of the project. First phase. Provide more 1 lakh gram panchayats with broadband connectivity by laying underground optic fiber cable, OFC, lines by December 2017. Second phase. Provide connectivity to all the gram panchayats in the country using an optimal mix of underground fiber, fiber over power lines, radio and satellite media by March 2019. Third phase. From 2019 to 2023, a state-of-the-art, future-proof network, including fiber between districts and blocks, with ring topology to provide redundancy would be created. What are the progress and milestones of BharatNet project? Previously, the challenge was to extend fiber-based internet connections to households after laying the infrastructure under the BharatNet project. To address this, a successful pilot was conducted in 60,000 villages, involving local partners to connect households. This success paved the way for the involvement of Udyamis in the project, expected to generate employment opportunities for around 250,000 people. Up to this point, the government has connected approximately 194,000 villages, providing internet access to around 567,000 households. Notably, 351,000 fiber connections have been established using the new BharatNet Udyamis project. What are the challenges to the BharatNet project? Slow progress and implementation delays. The project has faced significant delays in implementation, with the pace of progress being slower than anticipated. Despite the government's efforts to connect villages, only about 194,000 out of the targeted 640,000 villages have been connected so far. This slow progress has hindered the project's ability to bridge the digital divide in rural areas. Infrastructure and connectivity issues. The challenging terrain, lack of proper roads, and logistical difficulties have all contributed to delays in connecting villages. Connectivity issues have also led to poor service quality and interrupted internet access in some areas. Technical and operational issues. Technical challenges such as signal quality, bandwidth limitations, and network downtime have affected the overall user experience. Moreover, managing the operations, maintenance, and complaint resolution processes in a decentralized manner involving local entrepreneurs has proven to be complex and requires effective coordination. Competition from private operators. The presence of private telecom operators like Jio and Airtel in some rural areas poses a challenge for BharatNet. These private operators have established their own network infrastructure and services, making it important for BharatNet to offer competitive pricing and reliable service quality to attract users. Way forward. The BharatNet project faces a combination of technical, financial, operational, and awareness-related challenges. Addressing these challenges is essential for the project's success in achieving its goal of providing digital connectivity to every corner of rural India. Efforts should be made to expedite the implementation process by addressing bottlenecks and streamlining the deployment of infrastructure. Collaborative efforts between government agencies, local bodies, and private partners can help speed up the process. Ensuring a consistent and sustainable flow of funds is crucial for the project's success. Clear financial planning, allocation, and management are necessary to support the project's expansion and maintenance activities. Focusing on improving the quality of service is vital to attract and retain users. This involves addressing technical issues, ensuring consistent bandwidth, and minimizing network downtime. Digital Health Incentive Scheme. Why in news? National Health Authority, NHA, has announced an extension of its Digital Health Incentive Scheme, this, under the Ayushman Bharat Digital Mission, ABDM. The this, offering incentives of up to 4 crores rupees, has been extended till 31st December 2023. What is the Digital Health Incentive Scheme about? Under the Digital Health Incentive Scheme, this, hospitals, diagnostic labs, and digital health solution providers are incentivized to embrace transformative digitization practices. The scheme operates with the goal of fostering a digitally inclusive healthcare ecosystem that aligns with the larger vision of Ayushman Bharat Digital Mission. Eligibility. Health facilities, hospitals, diagnostic labs, and registered digital solution companies, DSCs, under ABDM's Health Facility Registry, HFR, are eligible to participate in the scheme. Incentive calculation. The financial incentives are based on the number of digital health records created and linked to Ayushman Bharat Health Account, ABHA, numbers of patients. Achievements. Incentive recipients, as of June 2023, A total of 1205 health facilities have registered under this, including 567 public and 638 private hospitals, clinics, and diagnostic labs. Digital solution companies. Among the 25 registered digital solution companies, 22 are from the private sector, demonstrating diverse participation. What is Ayushman Bharat Digital Mission about? The Ayushman Bharat Digital Mission, ABDM, is a national initiative that aims to develop the digital health infrastructure of the country. It was launched in September 2021. Ayushman Bharat is a flagship scheme of India which was launched as recommended by the National Health Policy 2017 to achieve the vision of universal health coverage, UHC. Objective: it aims to provide digital health IDs for all Indian citizens to help hospitals, insurance firms, and citizens access health records electronically when required. The National Health Authority, NHA, under the Ministry of Health and Family Welfare is the implementing agency. Unified Health Interface, UHI. Under ABDM, UHI is envisioned as an open protocol for various digital health services. UHI network is an open network of end-user applications, EUAs, and participating health service provider, HSP, applications. UHI enables a wide variety of digital health services between patients and health service providers, HSPs, including appointment booking, teleconsultation, service discovery, and others. Ayushman Bharat Digital Mission Sandbox. The sandbox, established under the mission, serves as a platform for testing technology and products. It aids organizations, including private entities, in becoming health information providers or users. What are the major challenges related to digital healthcare in India? Infrastructure and connectivity. Despite advancements, a significant portion of India still lacks reliable internet connectivity and necessary digital infrastructure. This hampers the ability to access and deliver digital healthcare services in remote and rural areas. Digital literacy. Many people, especially in rural areas and older populations, may not be familiar with technology or lack the necessary digital literacy skills to effectively use digital healthcare platforms and services. Data privacy and security. Maintaining patient data privacy and security is a significant concern in digital healthcare. Ensuring that sensitive medical information remains confidential and protected from unauthorized access is crucial. Telemedicine regulations. While telemedicine has gained popularity, regulatory clarity regarding the practice, prescription of medications, and teleconsultation across state lines has been a challenge. Way forward. Blockchain for health records. Implement blockchain technology to securely store and manage electronic health records. Patients could control access to their data while ensuring data integrity and interoperability among healthcare providers. Data analytics for public health. Leverage big data analytics to predict disease outbreaks, plan resource allocation, and devise targeted interventions to manage public health challenges more effectively. Online training and skill development. Train healthcare professionals in using digital tools effectively. Offer online courses for medical professionals to upskill in areas like telemedicine, data analytics, and AI applications in healthcare. Digital health policies and regulations. Establish comprehensive regulations and guidelines for digital health technologies, ensuring patient privacy, data security, and ethical use of digital services and other technologies. Digital India RISC-V, DIR-V program. Why in news? Recently, the Union Minister of Electronics and IT addressed the Digital India RISC-V DIR-V symposium organized by IIT Madras in Chennai. The one-day symposium, organized by IIT Madras, emphasized the government's vision for DIR-V, which currently aims to build a robust ecosystem for RISC-V with effective public-private partnerships and collaborations with premier academic institutions. What is the Digital India RISC-V DIR-V program about? The DIR-V program is a forward-looking initiative that aims to uplift India's semiconductor ecosystem. Its primary goal is to promote indigenous innovation in the field of microprocessors, laying the foundation for self-reliance. The program emphasizes three key principles: innovation, functionality, and performance, shaping its direction for the future. Navigating complex digital realities. The program acknowledges the increasing demand for silicon chips in today's digitized world. As emerging technologies like 5G and 6G reshape the digital landscape, DIR-V anticipates finding applications in various areas such as cloud services, Internet of Things, IoT, and sensors. Integral role in high-performance computing. DIR-V is positioned at the heart of India's aspirations for high-performance computing. Collaborations with organizations like the Center for Development of Advanced Computing, CDAC, and public-private partnerships will ensure that DIR-V plays a pivotal role in these ambitious goals. RISC-V. The term RISC stands for Reduced Instruction Set Computer, which executes few computer instructions, whereas V stands for the fifth generation. It is an open-source hardware ISA, instruction set architecture, used for the development of custom processors targeting a variety of end applications. It also enables designers to create thousands of potential custom processors, facilitating faster time to market. The commonality of the processor IP also saves on software development time. RISC-V processors find versatile applications in wearables, IoT, smartphones, automotive, aerospace, and more, offering power efficiency, performance customization, and security. They excel in space-constrained designs and complex computational tasks. The RISC was invented by Professor David Peterson around 1980 at the University of California, Berkeley. Center for Development of Advanced Computing, CDAC. It is the leading R&D institution under the Ministry of Electronics and Information Technology, MATEI, specializing in IT, electronics, and related areas. Established in 1988 to counter the denial of supercomputer imports, CDAC's journey began with the development of India's first supercomputer Param. CDAC plays a pivotal role in India's IT revolution by continuously innovating and leveraging its expertise to develop and deploy IT products and solutions aligned with the nation's policies and market needs.